Let me start. Okay, as we promised you that we will have a series of postgraduate residency pathway guidelines. So fortunately today we have one of the introductory class where you will be familiarized with the different residency pathways, and later on we will be taking all those residency pathways one by one and we will be explaining them to you that you can get familiar with these postgraduate residency programs. And we will explain the drawbacks, the pros and cons of every single residency pathway. So first of all, if you guys, I'm sure that majority of you know me, but if any one of you doesn't know, then my name is Dr. Saeed Ilyas, and I'm working as a postgraduate resident in surgery, FCPS surgery. So moving on. Okay, so our focus today is on FCPS Part 1 exam, but I will be superficially touching some of the postgraduate residency pathways which are available for MBBS students once you guys are completing your MBBS degree. So we have career options for doctors after MBBS. You have options in Pakistan, and there are two options in Pakistan. One is FCPS, and which is Fellow of College of Physicians and Surgeons. This is a fellowship exam, and then we have MD/MS option. MD is for doctors who are looking for post-graduation in medicine, and MS is for doctors who are looking for post-graduation in surgery. So FCPS, we will be more focusing today on FCPS exam, and next session we will be looking after some of the residency pathways in Pakistan regarding MS and MD. I think somebody is saying that there is problem with mic. I don't think so, Dr. Gulif. I think I'm clear. Okay, I think you have. Okay, thank you so much for your feedback. I think this is your own issue. This most probably it will be your internet problem, so you can fix it yourself. So we have FCPS, and on other side we have MD/MS, and I'll be a little bit touching on the MD/MS, but our more focus is today on FCPS exam. So MD/MS, the drawback about MD/MS is that once you clear the MD/MS exam in a hospital in Pakistan, you can apply only in that specific hospital. Like if you are looking for postgraduate residency in MSMD, like in Pakistan Institute of Medical Sciences, which is PEMS, or through JCAT pathway, which is Joint Centralized Induction. So if you are looking to these two postgraduate residency programs, there actually you can be inducted in these specific hospitals. But JCAT is a slightly broader, but PEMS is a slightly more narrower option, because once you clear your post-graduation in MD/MS at PEMS hospital, you will have chance to be able to be inducted in one of the three hospitals which are affiliated with Pakistan Institute of Medical Sciences, formerly known as PEMS hospital. So there is only PIMS hospital, CDA hospital, and one other hospital. So you can apply only in these three hospitals. But if CPS gives you a broader option, like you can apply all over the Pakistan in private section and government section, everywhere. So this is the beauty of FCPS. So you can look for both options, but FCPS is giving you a slight edge. Then we have in the UK, we have PLAB, and we have MRCP and MRCS. PLAB is for those people who are actually wanting to practice in the UK as a doctor, and they are looking for residency programs there. They are going to go through stepwise pathway, go for inducting themselves and involving themselves in a residency program in the UK. So you can pursue this PLAB pathway. In PLAB, actually, there is a requirement for PLAB. Before giving PLAB, you are supposed to go for OET exam, which is occupational English test, and you have to take 4B for that. And other exam is IELTS, which is International English Language Testing System. And this PLAB stands for Professional Linguistic Assessment Board, which is conducting an exam for residency in the UK. So most probably this will be converted into UKMLE later on in 2024 or later. But the exam pattern will remain the same. So PLAB, once you clear your OET and get 4B, later on you are eligible for PLAB exam. And in PLAB, you have two exams. There is PLAB 1, which is a theory exam, and you have PLAB 2, which is a clinical exam. Like you will have certain stations, you have to prepare for that. And once you clear both these PLAB 1 and PLAB 2, then you will be eligible to apply for GMC. GMC stands for General Medical Council, and this is the council body who is authorized to give license to doctors in the UK. Like we have here in Pakistan, it's Pakistan Medical and Dental Council, which was before Pakistan Medical Commission. These are interchangeable terms. Sometimes you will get PMDC and sometimes you will get PMC. So in Pakistan, we have this particular organization who is authorizing doctors to practice, and they are giving you the license. But in the UK, there we have GMC. So you can get the GMC through PLAB pathway, or you can also take your GMC from MRCP or MRCS pathway. MRCP is specifically for doctors, and this is a good option actually for those doctors who are looking for an additional degree, but they are working in their home country. Like if I'm working here as a resident surgeon in Pakistan, I can take MRCS exam. And MRCS is actually, it stands for Member of Royal College of Surgeons. And MRCP stands for Member of Royal College of Physicians. So this is actually, MRCP is actually for doctors who are practicing medicine, and MRCS is for doctors who are practicing surgery. Through this pathway, you will not be able to go to, you can go to UK, you can get your GMC registrations. Once you clear an MRCP, you have three parts. There is part A, part B, and then PACES. Once you clear your 3 steps, you will get your GMC registration. But this training that you are if you are working in Pakistan or your home country in Afghanistan or any other country, and you get your degree from your country, like you get your MD degree or any degree from your home country as a postgraduate resident, and later on you complete your specialization, you can take alongside your residency this MRCP exam. And once you clear all these 3 steps, you will get your GMC registration, and the training you have done from your home country will be counted for you. And MRCS is similarly for doctors who are working as a resident in their home country and in the field of surgery. Like if I'm working here as a resident surgeon, I can take 2 parts of MRCS, 2 parts. Unlike the MRCP, it has 2 parts. There is MRCS Part A, which is a theory exam. And similarly, we have MRCS Part B, which is a clinical exam. You have to you can take MRCS in Pakistan, and it has MCQs from basic side and from clinical side, and specifically from surgical side, not from other specialties. You will have to answer certain questions. You will face certain MCQs, which are from some chapters of Belay and Love practice of surgery. So you have 2 pathways in UK. Either you can go through PLAB pathway, or you can go through MRCP and MRCS pathway. We will discuss all these pathways later on in details. Then we have in United States of America, we have 2 options. We have USMLE, which is United States Medical Licensing Exam, and it has 3 steps: step 1, step 2, and step 3. And once you are done with all these steps, and you can apply for match in the USA, and you can match in any one of the system. But deciding between the Pakistan, UK, and USA, you will have to look for your resources. If you're stable enough that you can apply for any one of these residency exam, first of all, you can apply for United States medical license exam, which is USMLE, but it is slightly costly. You have to spend around 15, 20 to $25,000 until you match in the United States. So if you're financially stable, you can go for USMLE. It is a long route, but at the end of the day, it will pay you a better salary, and the training is slightly better than other options. And a slightly cheaper than USMLE, you can go for a UK either through PLAB pathway or MRCP pathway, but you have to choose yourself in looking to your financial status and other things. Taking all those things in consideration, you have to decide either to choose USA, UK, or Pakistan. And we have certain other pathways, and in these pathways we have Australian Medical Council, which is called AMC. We have one option here. This is our AMC, or this is Australian Medical Council. You can take Australian Medical Council exams, and then you can go to Australia and you can work as a doctor. And here in USMLE, one we have USMLE, and one is another alternative pathway. An alternative pathway, what you do practice in your home country, you complete your specialization, and then you have to clear USMLE steps, step 1, step 2, and step 3, and later on you can apply for fellowship there. You apply for fellowship in the United States, you go to United States, you do your fellowship 2 or 3 years, and then after that you will have to again apply for match, go and match in any one of the residency programs, and later on you can complete your residency and you can practice as a doctor in the United States. But with a fellowship that is 3 to 4 years, you will not be able to practice in the UK, in the USA, but however you can work outside USA, like in Middle East and other countries. But in order to practice in the United States, you have to go for fellowship. After fellowship, you have to go for residency, complete your residency, and then you can apply, you can work in the United States. And other than AMC, we have Germany. Another option is Germany. And in Germany, what you have to do is, certain people don't like this pathway because it requires language. You have to learn their language, like German language, which is one of the difficult languages in the world. So first of all, there are certain categories of the language. German language, there is A1, then you have A2, then you have B1, and then you have B2. So at least you have to learn, you have to be in the state of that you can have B2 certificate, that you will be eligible to work as a doctor in the Germany. So this is a slightly difficult, but you can learn. You can learn German language. You can start it early on, like you can learn German language in area you are practicing, and then if you have a long goal, you learn the language till B1, and then after completing B1 certificate, you can apply for through certain pathways in Germany, and you can go to German. And then other pathways, you can also have Denmark and all the European countries, but the drawback is that you are supposed to learn their language. If either you will go to Denmark, you have to learn Danish language. If you're going to Germany, you are supposed to learn Dutch language, and other countries similarly. So these are the available options as a postgraduate residency program for a doctor after completing MBBS. So as I told you before, today we are more focusing on fellowship exam, which is FCPS, Fellow of College of Physicians and Surgeons. Okay, I'll at the end of the session, we will have a Q&A, and then you can ask me your questions and I'll answer to your questions in multiple languages. Even you can ask me in Farsi, you can ask me in Pashto, Urdu, and at the end you can ask me in English as well. So yeah, we will describe all those alternative pathways and things to you, but today our focus is solely on FCPS part 1 exam. So what is FCPS? It is actually a fellow of College of Physicians and Surgeons, and it's usually conducted by CPSP, which is College of Physicians and Surgeons. We have something called CPSP. CPSP. This is College of Physicians and Surgeons, Pakistan. So they are conducting this exam. This exam has 3 parts. There is part 1, then you have IMM, and then you have part 2 exam. First of all, you are supposed to clear your part 1 exam. FCPS, once you clear your FCPS part 1 exam, then you will enter into your residency program. You are supposed to apply through CIP pathway or other pathways, and you can apply all over the Pakistan in any one of the hospitals, like in private setup, in government setup, everywhere you can apply with your part 1 after clearing your part 1 exam. And then once you complete your two initial years of training, then you'll have to take your IMM, which is intermediate module. After taking intermediate module, you will enter into, but it is not necessary to take it immediately after completion of your 2 years training. You can take it later on, but meanwhile you can continue your training as a 3rd year resident. And then at the end you have to take part 2, which is an exact exam. Once you clear your part 2 exam, then you will be working as a consultant, either resident or consultant, physician, or surgeon. So these are the basically three exams of the FCPS. Okay. This is one of the most important thing, which I personally didn't know these things. So after coming and joining my residency, and this is really important to understand these 2 groups of subgroups of the medicine and allied specialty. So we have different disciplines. You can apply in medicine and allied, you can apply in surgery and allied, but other than medicine and allied and surgery and allied, if you are looking for psychiatry, it has a different exam. If you are looking for radiology and pathology, you will have to prepare in a different fashion. So these are the available options for you. Either you can go to medicine and allied, and then medicine and allied has certain specialties that we will be explaining them later on and subsequent slides. But these are the broader categories. If you are looking for psychiatry, you have to take separate exam. Radiology has a separate exam. Pathology, the form is different, the application form is different, and the preparation is different. So you have to understand these 2 different specialties. And then you have surgery and allied. You have to look for surgery and certain subspecialties of surgery. This is one option, and this ENT is not under surgery and allied. You have to apply and prepare differently for this ENT exam. And then you have eye exam, you have anesthesia, and you have gynae and ops. These are the available specialties. And you have dentistry as well, if we have any dentist here. So you guys also have an exam which is called dentistry, so you can apply for that as well. These are the broader categories. Okay, in medicine and allied, we have 2 groups. One is group A and another is group B. You have to understand this because this is really important. In medicine and allied group A, we have cardiology. This is, so this is cardiology. You have pulmonology, you have nephrology, you have clinical hematology and neurology. these are the four specialties which are available in Group A of Medicine in Allied. So why we are supposed to understand these basic things? Basically, whenever you are applying for a specialty here, let's suppose you have applied for in these specialties you applied for pulmonology. Once you enter into the FCPS program, you passed your FCPS part 1 and then you inducted in your residency program. Then if you are in a medicine in Allied, you have to take for 15 months of initial training in general medicine. And then after 15 months of your training, you have to, if you are in Group A, you have to rotate through all these specialties. Like if you are you applied for neurology, you are supposed to do your cardiology rotation, do your nephrology rotation, pulmonology rotation, clinical hematology rotation, and neurology rotation as well. So you will do your all these rotations, and then after that you are supposed to go to your own specialty. Let's suppose you applied for neurology, and neurology is in Group A. You have to take all 15 months of general medicine training, later on 2 months of these rotations. And after the rotations, cardiology is must for everyone, but in these rest of three, in these 3 rotations, you can miss 1 rotation, but you have to take rest of the 3 rotations. Cardiology is must. You have to take this for everyone, either it be it Group A or Group B. You have to do your cardiology rotation. This is must for everyone, and this is for 3 months. And rest of the rotations are optional. You will have to do 3 rotations, but you can skip any one of them. But you cannot skip cardiology rotation. Once you complete 2 years of your training before IMM, let's suppose you have done your training, you applied for neurology, but during your training, you turn out that you are more into cardiology. You liked cardiology during your rotation. You are not more interested in neurology, and you want to switch to cardiology, then you can switch to cardiology rotation, right? After 2 years of training, initially you applied for neurology, but you didn't like it during your rotation, so you would like to go to cardiology. You can go to cardiology later on after 2 years. Similarly, if you didn't like neurology and you want to go to pulmonology, you can go to pulmonology. And similarly, if you didn't like neurology and want to go to clinical hematology, you can change it. You can go to any one of these specialties in your group, not in another group. If you are looking for a specialty, like you are looking for dermatology, but you don't have dermatology in Group A, you are supposed to go to Group B, select any one of the specialty which has a low merit, and then you can shift to that specialty later on after 2 years of your initial training. That's why understanding this basic thing is very important. And then you have a Group B. In Group B, we have again cardiology is cardiology and clinical hematology are they are compulsory, and they are combined specialties in Group A and Group B. But here dermatology, you have dermatology, you have medical oncology, and you have gastroenterology. These are the additional specialties, the 3 additional specialties. Again, here you have to go 15 months of general medicine training, followed by 3 months of cardiology training, and then you can choose any one of these training for 2 months. And if you applied for gastroenterology, you can go to cardiology, you can go to dermatology, you can go to medical oncology or clinical hematology. You can switch between any one of them after 2 years of your initial training. You can go to your own specialty. If you choose gastroenterology, you can go for a gastroenterology. But if you didn't like it during your 15 months of training, and then later on you did your rotation, you don't like gastroenterology, then you can go for medical oncology, dermatology, and any one of these rotations. You can switch it. So this is Group B, and hopefully you understood this basic concept. Then we have in surgery and allied, we we have again group A and group B. Group A comprises orthopedic surgery, cardiac surgery, thoracic surgery, and pediatric surgery. Sorry, this is group B. We will have, this is group A. So in group A, again, orthopedic surgery, like in medicine and allied, cardiology was share specialty and compulsory specialty. Here, orthopedic surgery is necessary. Every surgeon has to go through orthopedic surgery rotation for 3 months. So here what you do, again, like in surgery and allied rotation, here you'll have to do 15 months of your general surgery rotation, followed by 3 months of orthopedic surgery rotation, which is compulsory. Everyone should take this 15 months, 3 months of orthopedic surgery. And then if you are falling in group A, you applied in on any one of the specialty of group A. Let's suppose you applied for neurosurgery. You have to take 3 months of orthopedic surgery, 2 months of plastic surgery, 2 months of urology, and 2 months of neurology. And after once you complete your 2 years of training, then you are supposed to go to your specialty, like you are supposed to go to neurosurgery. But in between, if you during in case you didn't like your neurosurgery during your rotation and you want to go for orthopedic surgery, you can switch between. You can go for plastic surgery, you can go for urology, any one of your group specialties. So this is basically how it works. And then you have group B. In group B, let's suppose you have again you have 4 specialties. Orthopedic is same. You have to again take 15 months of general surgery training. You have 15 months of general surgery training, and after that 3 months of compulsory orthopedic surgery training, followed by rotations in cardiac surgery, thoracic surgery, and pediatric surgery. So here what people do, they usually apply for cardiac surgery in this group, which has a low merit, and also thoracic surgery has a low merit. So people come and join thoracic surgery or cardiac surgery, and after 2 months, 2 years of their initial training, then they are going to switch their specialty. They are going for orthopedic surgery or they are going for pediatric surgery. So because merits for these two specialties is slightly higher, so they are opting for this initially, and later on they are shifting into the any one of these two specialties. So you must be very clear to select groups while you are applying for specialties. Let's suppose you are looking for urology, but merit of urology is very high. In group A, you have a specialty which has low merit. Neurosurgery has a slightly low merit in Pakistan. So you can apply for neurosurgery. Once you are inducted, after 2 years of your initial training, you can go for urology. But if you apply in this group, group B, you will not be able to go for urology because this is not in your group. So this is important. Then coming to FCPS Part 1 exam papers, it's a long exam, 4 hours long exam, like 2 hours for paper 1 and 2 hours for paper 2. It's actually a computer-based exam. You have paper 1 and you have paper 2, 2 hours for paper 1, 2 hours for paper 2, and this is a computer-based exam. Paper 1 has 100 MCQs and paper 2 also has 100 MCQs. There are 100 MCQs each, and once you are done with your paper 1, you will have a break of 30 minutes, and then you have to go again and sit for paper 2. And these 100 MCQs which are coming for paper 1, they are same for all specialties. Either you are applying for radiology, you are applying for medicine, surgery, any specialty, they are same. These 100 MCQs are same for all the specialties. But in paper 2, it's slightly different. It is slightly specialty oriented. Like let's suppose if you are applying for surgery, you will be more tested on anatomy. But if you are applying for medicine, they'll more focus on diagnosis and pathophysiology diagnosis on those things. But if you are again looking for radiology, they will be more focused on anatomy, because you have to know all those certain areas of um, the lymphatic drainage and all those systems. So yeah, of course you have to know these things. That this is about your exam. You have to reach 15 minutes before your exam. You will have an examination card. You have to carry that examination card along with you. They'll scan your examination card. You will go enter into your examination hall. There will be a certain place for you where you can, somebody's writing, please avoid writing. And then there will be a specific laptop for you. You can go and sit in front of your laptop, and then there will be, this is a very nice exam actually, and they will give you a code. You have to enter that code, and then the paper will be displayed to you. You can see your MCQs and you can solve them. And you can, if you don't know any one of the MCQs, you can skip it, and later on at the end of the paper you will get those MCQs once again. So these are the basic things. Next, so coming to the resources, people will I know in different groups people will recommend you different books, different resources. And indeed you can follow whatsoever is easy for you, but I personally recommend these two books. One is Muhammad Naseem Shirzad, which is hired, very nice book. It's and another book is FA, which is First Aid for USMLE Step 1. So if you combine these two books, FA is very good in pathology and in physiology, but it has slightly deficiencies in anatomy. So Naseem Shirzad will cover that anatomy. It has beautifully written anatomy from different regions, and yeah, you can combine these two books for better understanding, and you can apply it in exam as well. So Muhammad Naseem Shirzad plus First Aid. I do recommend Muhammad Naseem Shirzad before reading First Aid, because if you have a gap of 3 or 4 years between your basic sciences or your graduation and FCPS Part 1 exam, you will definitely have difficulty retaining First Aid. So if you read Muhammad Naseem Shirzad hired first, and then you go and read First Aid, it will be very easy for you to retain First Aid. You don't need to go and watch Board and Beyond videos. You don't need to go and watch Dr. Najib videos, osmosis, and blah blah. But if you read Muhammad Naseem Shirzad and then you revise that system from First Aid, then it will make your theory very strong. So these two books are my recommendation. You can also read other books. I will mention those books that you can read. You can also read these specific books. I'll write down. People are recommending Snell Review. Snell Review. There are two books for Snell. One is Big Snell and one is Snell Review. Snell Review. Second, you have BRS for physio, and you have BRS for patho as well. In FCPS exam, you will have to divide your subjects into two groups. One is major and one is minor. In majors, you have these three books, like anatomy. You have anatomy, you have physiology, and you have pathology. These are major, and actually they are 70 to 80%. You will be tested in these subjects 70 to 80%, and 20 to 30% your MCQs will be from minor subjects. And minor subjects are here, you can say microbiology, and you can say other biochemistry, biostates, and these subjects are like histology. These are your minor subjects. So you will have 20 to 30% MCQs from minor subjects. You will have 70 to 80% MCQs from the major subjects like anatomy, physiology, and pathology. So you have to understand and then prepare accordingly. And these two books are covering everything for theory. You are not supposed to go, because I personally understand that if you use multiple resources like Snell review, BRS physiology, and BRS pathology, it will be difficult to revise these multiple books in the last few days. So that's why I recommend these two, and these are more than enough for your exam. Then we have question banks. Actually, my personal recommendations are, and I'm always recommending to my juniors, and they are pretty happy with these question banks. So Medicol is actually for system-wise MCQs. How how it works, like if you study one system, let's suppose we are studying CVS system, and in CVS system you are studying physiology. Once you are done with physiology, go and do CVS physiology MCQs from Medical, because there will be a separate chapter for physiology, and in physiology again there will be subdivision of CVS physiology. So you can easily assess yourself once you read theory from first aid in Naseem Shirzad, then come to Medical, read those specific, like if you studied physiology theory, then you can assess yourself from Medical, and there will be 300 or 400 MCQs. There will be 300 or 400 MCQs in CVS physiology. You can assess yourself, and then you can understand. And actually, if you read these MCQs are actually coming in your exam, and they are actually testing you from those past papers. So 50 to 60% MCQs will be repeated from these Medical MCQs. There are almost 10 to 15,000 MCQs in Medical. If you do these MCQs plus those theory books, then it will help you a lot in other exams as well. And then we have Rafiola and SK. In Rafiola, once you cover these three books, Naseem Shirzad, First Aid, and Medical, your 90 to 95% FCPS preparation will be done, and Rafiola will be also covered, and always 90% Rafiola will be covered, and 100% SK will be covered. So these two books are actually for last 10 days, last 20 to 25 days. In Rafiola Pearls, there will be it has one-liners. It has one-liners. Like let's suppose there is an MCQs that on a renal function. So you will have all those MCQs which previously came in FCPS exam, FCPS part 1 exam. All those MCQs will be compiled in one single page. So before studying first aid and MNS and Muhammad Naseem Shirzad in Medical, it will be difficult for you to retain these one-liners. That's why this is important to make your solidify your concept before jumping into Rafiola. And once you are done with these basic things like Medical, MNS, and first aid, you can do Rafiola within 10 to 12 days. And within months, you can revise Rafiola 5 to 6 times, which will really help you in your exam. And in SK, you will have last, like let's suppose the previous exam was in February, no, and Fab, and then later on the next exam will be in May. So all those MCQs which were recalled from Feb attempt, those MCQ will be compiled in the SK. SK stands for Salahuddin Kamal. This was the person who compiled these MCQs, and still he is compiling. He compiled MCQs from the last 10 to 15 years. He is compiling MCQs from 2005 till date. So these are also important. You will have SK of your own specialty. Like if you are looking for surgery, you will have SK surgery. If you are looking for anesthesia, you will have SK anesthesia. And in this SK anesthesia, last 10 or 5 golden files will be compiled. which are solely from your own specialty. If you are from anesthesia, these MCQs will be from anesthesia. If you are from general surgery or general medicine, it will be compiled in this fashion. So it will also help you in the last days. So these two books like Rafiola and SK, you must keep these two books for the last 10 to 20 days or last 30 days. It will help you a lot in the exam. So after that, so time required and how to prepare. Uh, Ideally, people will recommend you 10 to 15 days. Some people will tell you I have prepared in 10 to 15 days. Some people will tell you that I prepared and in 1 month, 2 months. But ideally, you have to give it 2 to 3 months. It's more than enough. And prepare module wise, like if you are studying a cardiovascular system, you have to complete cardiovascular system. And ideally, I recommend to all my students and to all my juniors to start from these cardiovascular system, because cardiovascular system is slightly interesting, and you can learn a lot from cardiovascular system, and it is slightly interesting. You can start from there, and then you can move on to the next systems like respiratory system and GI and the rest of the systems. So prepare module wise, do one module, complete one module. Like if once you start your CVS physiology, do anatomy, then physiology, and then pathology, and at the end do pharmacology of that particular system, and then you can move to the next system. So this way you will have a bit better understanding of the subject. And then you can divide your preparation into 3 phases. Phase 1 is first 2 months, only 2 or 3 books. As I told you before, this is the important phase that you have to prepare yourself for the game. And you have to use, either you can use 2 books or you can use 3 books. You can only use Muhammad Naseem Shirzad with medical. If it is difficult, if you are unable to retain first aid, you can solely use these 2 books. But if you use first aid along with Muhammad Naseem Shirzad, it will help you a lot in other exams as well in Pakistan. So Muhammad Naseem Shirzad is also a good book, but first aid will add more into it. So you can use this for initial 2 months, nothing else. You have to use these 3 books for initial 2 months, and after that, in next 30 days, you or 15 or 20 days, you can focus on your weak areas. Once you are done with these, you can then look for your weaknesses, check them. If you are weak in any one of the area, like if you are weak in cardiovascular system, you are weak in endocrine system, go and do that system once again, and make it perfect in these last 15 to 20 days. But in last 30 days, what you can do, exclusively focus on Rafiola. This Rafiola is a game changer. You have to focus on this one and SK1. So I have already told you that these are the same resources, but they are written in a different fashion. And Rafiola will help you a lot in last days in SK as well. So in last 25 to 30 days, solely focus on these 2 books. It doesn't matter if you are preparing for medicine or surgery, you have to focus on these 2 books. And I will be having a separate video regarding review on different books. Like I'll show you how to prepare MNS, how to study first aid, how to study medical, and I'll have review on Rafiola and SK series as well. So this is basically an introductory lecture in how to prepare for the exam. As I already told you, you have to divide your subjects into majors and minors. In majors, you have anatomy, physiology, pathology, and pharmacology. Once you cover these things, you can shift to minor subjects, and minor subjects are microbiology, histology, embryology, biochemistry, and biostat. And they are actually contributing 20 to 30% into your paper. And these above major subjects are contributing 50 to 60%, sorry, 70 to 80%. So you have to take everything in consideration and then you start your preparation. Thank you so much. This is the end of our today's session. We will have our USMLE A to Z tomorrow at 10 p.m. But today, if any one of you has any question, I'll just allow you to unmute yourself and you can ask me. Yes, I'm really sorry. I forgot to tell you, somebody, if you are looking for peds medicine, it also comes under a specialty of medicine and allied. Let me stop the recording and then we can discuss everything.